morning. My name is Laura. I'm a student nurse practitioner.
Hi, I'm Rebecca.
And what's your date of birth?
8/25/95.
Perfect. Did you drive yourself today?
Yes.
All right. And do you live at home or with people?
At home.
Okay.
Alone.
All right. What brings you in today?
I just need a physical.
Okay. When was your last physical?
Last year.
Any issues or concerns from that visit?
No.
Okay. Otherwise healthy? Any issues or medical problems that you're aware of?
No.
Have never been diagnosed with anything that you know of?
No.
Any significant illnesses?
No.
Have you ever had any surgeries?
No.
Have you ever been hospitalized?
No.
Any traumas, injuries, broken bones, anything like that?
No.
Okay. Are you up to date with your vaccinations?
Yes.
Received your childhood vaccinations?
Yes.
Okay. When's the last time you had a tetanus shot?
Last year.
And what about the flu vaccine?
Last year.
You get it every year?
Yes.
Perfect. And have you been, had your COVID vaccine?
Yes.
Okay. 2 doses?
Yes.
Okay. Are you on any medications right now?
No.
Nothing prescription?
No.
Any herbal or anything like that? Vitamins?
No.
And do you take any over-the-counter medications?
Tylenol.
Okay. How much Tylenol?
200 milligrams.
200 milligrams. When do you take that?
During a period.
Okay. Does it help?
Yes.
Okay, good. All right. Are you allergic to any medications that you know of?
No.
Anything over the counter that you're aware of that you're allergic to?
No.
Food, seasonal, bugs, nothing like that?
No.
Okay, good. And we're going to go over our family history just a little bit. Does mom or dad have any medical problems that you know of? Cardiac, pulmonary, cancers?
No.
No? Okay. What about maternal grandparents
No.
or great grandparents? Nothing? No. Okay. Any hypertension in your family?
Yes.
Who has hypertension?
My grandma on my mom's side.
Okay. And do you know about your great grandparents?
No.
Anything? You know, out what they passed of or when they died?
No.
Okay. But both grandparents on mom and dad's sides alive?
Yes.
Okay. And your dad alive and well?
Dead.
Okay. What did he pass of?
Suicide.
Okay, I'm sorry about that. Do you know how old he was?
Like 32.
Okay. And do you go to work or school?
Work.
Where do you work?
Surgical tech.
Okay. How are your family relationships?
Good.
Good family, friends?
Good.
Good. Good friends. What do you like to do for fun?
Hike.
Okay. Any stress? How do you handle your stress?
By working out and hiking.
Okay. And do you have any religious beliefs?
A Christian.
Okay. And do you smoke?
No.
Any tobacco products, vape, anything like that?
No.
Okay. Do you drink alcohol?
Occasionally.
How often?
Maybe like once a month.
Okay. Any recreational drugs?
No.
Are you exposed to any environmental risks that you know of?
No.
How's your diet? 3 meals a day?
Yes.
Okay. Fruits, veggies?
Yes.
Okay. Do you drink, how much water do you drink?
At least like 4 or 5 cups a day.
Okay. And do you exercise?
Yes.
How often?
1 to 2 times a week.
Okay. Any recent travel?
No.
Are you sexually active right now?
No.
Any concerns about domestic violence or safety?
No.
Okay. You're doing great. All right. And no medical problems or anything like that. Do you suffer from fever, vomiting, night sweats, anything abnormal like that? Okay.
No.
Chills, nothing you can think of?
No.
Okay. Any issues with your skin, hair, nails, nothing that you notice?
No.
Hair's not falling out, not abnormal growth or anything like that? Any issues with your head, trauma, anything like that?
Nothing. No.
And then I see you wear glasses. When was your last eye exam?
Last year.
Okay. Any contacts?
Yes.
Okay. Occasionally wear them in and out?
Yes.
Okay. This year. Any drainage or pain or redness with your eyes?
No.
Any issues with your ears, pain, drainage, hearing loss, or any issues or concerns?
No.
Okay. Nose and sinuses, congestion, bloody noses, irritation,
Nope.
runny nose, nothing like that. When was your last dental exam?
Last year.
Okay. Any issues with your mouth or throat, pain in your neck, difficulty swallowing, anything like that? Okay. Able to move your neck okay without pain too?
Yes.
Okay. And then any issues with your breast, lesions, bumps, drainage, anything like that?
No.
Have you ever had a mammogram?
No.
Okay. Do you perform self-exams at home?
Yes.
Good. How often?
Once a month usually.
Okay. Any issues with your lungs, coughing, wheezing, anything like that that you're think of? No difficulty breathing?
Nope.
Okay. Are you able to work out okay without any palpitations or any shortness of breath or anything like that? You would think cardiac issues? Okay. Any nausea, vomiting, constipation, diarrhea?
No.
How often do you have a bowel movement?
Twice a day.
Okay. Any difficulty urinating, anything with your urine? Nothing like that? No bleeding or anything abnormal that you can think of?
No.
Have you ever had a kidney stone?
No.
Okay. Not good. Do you see a gynecologist regularly?
I do.
When was your last pap smear?
Earlier this year.
Okay. Any issues or concerns or been diagnosed with anything?
Nope.
No drainage or anything like that, discharge?
Nope.
Or pain? Okay. Any dizziness? Anything neurological that you can think of that you have any issues with? Okay. Joints, swelling, pain, anything like that with your extremities?
Nope.
Okay. Have you ever been diagnosed with anemia
No.
or any blood issues?
Nope.
Okay. Have you ever had a blood transfusion?
No.
Any easily bruising?
Nope.
Do you have excessive thirst? Sweat a lot or anything like that? Okay. How are your menstrual periods? Do you have
Regular.
regular? Once a month?
Yes.
Okay. And then said dad passive suicide. Do you have any thoughts of harming yourself?
No.
Okay. Any other depression or anything like that for you?
No.
Okay. Alright, that's it of that. Do you have any questions about any of that we asked or concerns that you can think of that I didn't ask you?
No.
Okay. Okay, so we're going to start with the physical assessment. Alright. So I'm just going to throughout the whole thing, kind of look at your skin if you see me looking and touching, and I'll just do a full skin assessment through the whole time. I'm going to start with your head. I'm going to palpate your head, check for any lesions or masses, bumps or lumps in your hair, make sure everything looks good. Any pain or anything there?
No.
Alright, good. No deformity or anything like that. It looks perfect. Skin looks great. Don't see anything abnormal there on your face. We're going to check cranial nerve 7. If you could smile, good. Frown. Puff out your cheeks. Perfect. Raise your eyebrows. Good. And close your eyes really tight. Perfect. Cranial nerve 7 is intact. Going to go to cranial nerve 5. I'm going to test sensation. If something is dull, sharp, and soft, you tell me, okay? Close your eyes for me. What do you feel?
Dull.
Where's that at?
Left cheek. Sharp chin.
Good.
Soft right cheek.
Good.
Sharp forehead.
Very good. So that was cranial nerve 5, and that is intact and looks great. I'm gonna go ahead and check your vision. Visual acuity test. We'll do it with both eyes with your glasses on. Stand 6 feet back. Can you read this line for me?
LTFPH.
Very good. Cover one eye If you could read this backwards.
HPFTL.
Very good. Take a moment, cover the other eye, go back this way.
LTFPH.
Perfect. Cranial nerve 2 is intact. That was 2020 with corrective. If you, let me go ahead and do this. I'm gonna palpate these temporal arteries and we'll have you take your glasses off. Normal rate rhythm +2. Thank you. I'm gonna listen and then we'll do a little bit further with your eyes. Good. Good. No breweries noted. That's perfect. All right. I'm gonna check your range of motion. If you can look at this for me real quick and just follow it. Good. Cranial nerve 3, 4, and 6. Extraocular movements look good. Then I'm gonna come into here and we'll go with your glasses. Let me look in your eye first. I don't wanna mess you up. Just look in your eye. Look straight ahead. Look at your retina, nice and yellow. Looks good. Good. That's cranial nerve 2. Also, I'm gonna look at your conjunctiva and your eye, sclera. Make sure there's no lesions, drainage, anything like that. Perfect. That looks great. Also gonna do look straight ahead. Make sure your pupils are round and reactive to light. Perfect. They both are. Check accommodation. Look at this. Perfect accommodation. Perfect. All right, you can go ahead and put your glasses back on. I'm gonna check right here. Your frontal. I'm gonna come under here. Maxillary sinuses. Any pain or tenderness there?
No.
Perfect. You're doing so good. Switch some of this stuff out. Alright, I'm going to do cranial nerve 8 and test your hearing. Can you cover one ear for me? Repeat the word I say back to you in a whisper.
Ball.
Perfect. Do the other side.
Pickle.
Perfect. Good job. Cranial nerve 8 is intact. I'm going to continue with your hearing. This is a Weber test. I'm going to put it on top of your head. You tell me if you hear it bilaterally, equal on both sides.
Equal on both sides.
Perfect. And start over here. Check bone and air conduction. Can you hear that?
Yes.
Tell me when it stops.
It stops.
5 seconds. Can you hear that?
Yes.
To 1. Perfect. Normal test. Same thing on this side. Do you hear that?
Yes.
Tell me when it stops.
Stops.
Do you hear this?
Yes.
Perfect. That's great. 5 and 1 seconds. It looks perfect. Gonna check your ears. Just gonna palpate and feel, make sure there's nothing abnormal. Check your mastoid, any pain or tenderness there.
No.
Don't see anything abnormal. Looking at both your ears, both symmetric, which is great. I'm gonna look in your ear now. Look at your tympanic membrane, nice gray, conal light present. Perfect. Same thing on this side. You can turn that way. Good. Move your hair, palpate, check the mastoid, look at that ear. Tympanic membrane looks good, gray, conal light present. Doing great. Any questions so far?
No.
Okay. I'm gonna look at your nose now. No deviated septum, it looks great. I'll look in there. If you could look up. Nice and pink, no polyps, turbinates look good. Perfect. All right. Gonna check your mouth. Check your teeth. I'm gonna turn my light back on. Okay. Perfect. Say ah. Good. Cranial nerve 9 looks great. Elevation of the uvula. Teeth look good. Everything's pink, moist. Buccal mucosa looks great. I'm gonna check your tongue strength. If you could try to touch your, very good, all the way up and then down. Perfect. I'm gonna put this there. Kind of press against that. Good. Cranial nerve 12 looks great. Perfect. All right. Let's see. What should we go to next? I'm gonna actually do your carotids first. Just feeling, make sure everything's feeling normal pulse rate rhythm, and it does. That's perfect. +2. I'm gonna listen. Good. +2 on that side. Perfect. That sounds great. I'm gonna check cranial nerve 11. You can shrug your shoulders tight up against me, nice and strong. Perfect. Same thing on this side. Good. And then again. Perfect. That is wonderful. All right. Let me just process here. Okay. Let me do your lymph over here. Just gonna feel for you and palpate. Pre-auricular, post-auricular, occipital, tonsillar, submandible, submantle, anterior, posterior, deep cervical. Sorry, it's down. Supraclavicular. Perfect. That looks great. All right. Just make sure I don't forget anything before we move on to your back. All right. Just take a moment, sorry. Good tongue. Okay. All right, so we can move on to your back. Yeah, if you'll go ahead and turn, that'll be perfect. I'm gonna look at your thyroid. I don't notice anything goiter or anything like that. I'm gonna come around here and have you swallow. Perfect. Then we'll start with your back. Looking at inspiration. Go ahead and take a deep breath in and out. And expiration, good. Symmetric chest rise and fall. Do the same thing. Good deep breath in and out. Good chest rise and fall. Gonna come right here. If you could repeat 99.
99.
Perfect. Good vibrations and again.
99.
Good. Good. Tactile firmness present. All looks good. I'm gonna go ahead and just kind of percuss up here. Checking those bone fields. Perfect. I'm gonna come down here. Check for CVA tenderness. Any pain or anything with that?
No.
Perfect. I'm gonna take a listen now, okay? Take a good deep breath in and out. Good. Again. Again. Yeah. Good. Perfect. That looks great. I'm gonna just kind of slightly look right here on the side. Anterior, posterior diameter looks good. No barrel chest or anything like that, okay? You doing okay?
Yes.
Perfect. I'm gonna have you swing back around this way. All right, and if you can, if you're comfortable, go ahead and now take your gown off.
Yes.
Looking at your neck, make sure there's no jugular vein distension or anything like that. That's a part of a heart assessment. I'm gonna check interior chest. Take a good deep breath in and out. Perfect, that looks good. I'm gonna place my hands on you. Do it again, if you will. Good. And then here, if you could say 99.
99.
Good job. Everything looks great, nice and symmetric. Perfect. I'm gonna kind of palpate, make sure we don't feel anything abnormal, lumps, anything like that. I'm gonna percuss. Perfect. Sounds nice and good. I'm gonna listen here. Good deep breath in and out. Good. Again. Perfect. I'm gonna come right here, lateral. Again over here. Perfect, that looks good. Chest sounds great, everything looks good. We're gonna move on to cardiac. We're gonna have you go ahead and lay back. Comfortable?
Yes.
Okay. I'm just gonna look right here, PMI, look for anything pulsating, anything like that. I don't see anything abnormal. Everything looks good. And then we're just gonna take a listen to your heart in a few different positions, okay?
Okay.
Aortic, pulmonic, tricuspid, mitral, normal rate and rhythm. Listen with the bell. Good. I'm gonna have you lay left lateral, lay on your left side. We're just gonna do the same thing again, okay?
Okay.
Aortic, pulmonic, tricuspid, mitral. would lift under, but for video purposes, we're gonna keep you covered. Good. I'll have you sit up again. And kind of lean forward for me. Listen to that heart, just all different areas. Make sure everything sounds good, okay? Okay. Perfect. One more time. Get close. Kind of lean in. There you go. Sorry, it's a little awkward. Beautiful. Perfect. All right, before I lay you down, I'm going to check your cervical range of motion. If you could look down, up, all the way to the, and then left and right. Any pain or tenderness with that?
No.
Perfect. Any questions?
No.
You're doing so good. You can lay down for me again and do a little abdominal assessment, okay? Just look in first, make sure we don't see anything abnormal, no hernia, nice and flat, nothing distended or anything like that, okay? I'm going to listen to your bowel sounds in all 4 quadrants. Right lower, nice and gurgly. We like to hear those high-pitched sounds. Right upper, left upper, left lower. Perfect. Nice and gurgly. I'm going to go ahead and just kind of listen to your abdominal aorta right here. Switch this. Let's listen to a few arteries. Renal, iliac, good, and femoral. And listen over your liver here. Palpate this. I'm gonna actually lift you up. Just listen. Perfect. All right. And just palpate over the abdominal aorta. Palpate over your liver. I'm gonna percuss a little bit. Perfect. Just trying to measure here. Perfect. Liver's about 6 centimeters, which is normal. Looks good. I'm going to palpate your belly now. Just make sure we have no tenderness or pain, okay? Sorry, my hands are, I think they warmed up a little bit. Any pain or tenderness?
No.
Perfect. Oh, that looks good. If I can have you bring your knees up for me. I'm going to do a deep palpation. Just kind of press a little harder. You let me know if you have any pain or tenderness. Nothing?
No pain or tenderness.
Nothing feels abnormal, nice and flat, no, nothing hernias, masses, or anything like that. Perfect. That looks good. And that is everything for abdominal. I'll just make sure that spleen still feels good. Perfect. Arteries. Just palpate that femoral artery. Okay, perfect. That's good. If you can sit up for me. Sorry about the ups and downs. All right, we're gonna start with extremities. I'm gonna see your hands, kind of lay them out. I'm looking at your skin the entire time. Like I said, everything still looks good. I see no moles or anything abnormal. Gonna just kind of palpate your skin and look at your muscles, make sure everything is symmetric and looks great, which it does. I'm gonna go ahead and check your cap refill. That is good. Less than 3 seconds is immediate. Flip over to your palms. Good, everything looks good. No redness or anything noted. I'm gonna check let's check your range of motion. Perfect, that looks great. If you could open your arms, good. Go ahead and bring your arm back and around, checking shoulders, all range of motion. Bring your elbows in and out. Good, perfect. Fan those arms out, or hands, I'm sorry. Prevent me from closing them. Checking against resistance. Bring those hands up for me. Here, push, good, pull, good. And then open here, and then push against me, good, push, good. Same thing on this side, push, good. Good resistance and everything looks good. Let me do your pulses here. Just gonna do, relax, turn this way. Check radial or ulnar, brachial. Good. Do some deep tendon reflexes here. Brachialis. Good. Come back here. Good. Look at that muscle. Make sure it's perfect. Sorry. Come back here on this side. Hit that. Good. Good deep tendon reflexes. Put that there. We will use that again. Alright, extremities look good. That was all upper extremities. Let me go, we'll do that in a minute. Then we're gonna do lower. If I can, you can kind of just see your legs. You can stay covered. Look at lower extremities, looking at that skin. Everything looks good. Nothing concerned about. Just kind of palpate them legs, make sure muscles, everything feels good. Nothing swollen, joints look good and everything like that. Let's check that range of motion up and down, rotate ankles. Perfect. And we'll do resistance since we're here. Push against me. Good. Pull towards me. Push, and push. Good. Fan those toes out as far as you can. Very good. Try to prevent me from closing. Good. Good range of motion. I'll just palpate dorsal pedis right now. Dorsalis. Good. Make sure everything looks good. Popliteal, come towards me a little bit. Get behind these knees. Perfect. All right. We're going to do a little vibration test. If you could close your eyes, tell me if you feel this and where.
Right arm, left hand, right leg,
Good. Doing great.
left leg, left lower leg,
Good.
right lower leg, right foot, left foot.
Good. I'm just going to do some more tendon reflexes here and try your knee. Okay. Stay outside so we can see. Good. Perfect. Do back here, just relax that foot as far as you can. Good. Perfect. Good deep tendon reflexes. Okay. We're going to do range of motion too. I just want to make sure before I lay you back down. Go ahead and lay back down. All right. Gonna check range of motion and stuff and resistance with your knees. Perfect. No pain or tenderness there.
No.
And then if you could push towards me. Perfect. And back. Beautiful. I'm gonna check your range of motion on your hips. Good. Now resistance. Push towards me and back. Perfect. Doing great. I'm gonna come over to this side. Check range of motion here. Good. Push. Back towards me. Good. Do your hips. I'm gonna check. Good. Hold this range of motion. No popping, clicking. Everything feels good. Full range of motion. Good. Same thing on this side. Perfect. Bring your feet out, and while you're here, I'm gonna do a monofilament test. We check for neuropathy, people with diabetics and things like that. Please let me know when you feel this.
I feel it. 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 I feel it.
Perfect, you're doing great. Same thing here.
I feel it. 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 I feel it.
Perfect. All right, you're doing great. All right, go ahead and sit up for me. Kind of did a little bit of neuro with our resistance and stuff too, but now we're gonna check the cerebral, make sure everything is processing. If you could put your finger to your nose, touch my finger a few times. Good, same thing. Perfect. If you could rub your heel to shin and do that test for me, make sure we just rub it all the way down. Perfect, other side. Great, we're gonna check your hand movements. If you could flip over and now as fast as you can. Beautiful, everything looks good. Any questions so far?
No.
Okay, make sure we did our full assessment, we didn't miss anything that I can think of. And then we're gonna have you stand up. You're more than welcome to put your gown on if you're comfortable. Put your gown on. You you see us okay? No, okay.
Wanna be over this?
Yeah, we'll open the door. Okay. Barometer test, be good. Put your arms out, close your eyes, looking for balance. Can you hear me okay, you think? I'm gonna actually push towards you. Perfect. No, everything looks symmetric, not anything abnormal. If you could just walk normal, we're gonna check your gait. Good. Heel to toe, if you can walk heel to toe. Good. Now tippy toes. Good. And then heels. Good. And while I have you standing, if you'll turn around for me, do a little knee bend. Good. Beautiful. And then turn around one more time. I'm going to check your spine. Make sure everything looks good. Bend over for me. Checking that spine. Make sure it's nice and straight. No scoliosis. Beautiful. Stand up for me. If you could come back all the way. Just kind of lean back. There you go. And then stand up and lean to the left. And then lean to the right. Perfect. All right. Everything looks good. Do you have any questions or concerns? No. That completes our physical.